Welcome to the 63rd Bhutan Dialogues, Understanding and Safeguarding Legal Rights of the Key Populations, jointly organized by GSW Law Research Center, Berlin Foundation, and Save the Children Bhutan. This dialogue session will deliberate on factors contributing to equitable access to healthcare services for marginalized and underserved key populations in Bhutan, such as sex workers, LGBTQ+ individuals, and those of diverse socials. This discussion will delve into the legal, social, and cultural barriers that are hindering the access to quality education, healthcare, and legal population among the key population, and also explore the potential impact of decriminalizing or legalizing sex work and enabling sex workers to exercise their fundamental rights without pain. With this, may I now invite Dr. Tashi from Save the Children to deliver welcome. Dr. Tashi serves as the Senior Health Manager for the Sustainability of HIV Services for Key Populations in Southeast Asia Project at the Save the Children Bhutan. With a master's degree in public health from the University of Cape Western Australia, and PhD in Health and Society from University of Wollongong, Australia, Dr. Tashi's academic journey reflects a strong commitment to improving healthcare outcomes for vulnerable communities. His 9 years of service at MOH and his current role at the Save the Children Bhutan brings significant experience and expertise in the efforts to promote the sustainable public health. Please, Dr. Tashi.
Very good afternoon to everyone of you here today. It is really amazing to be here in this August hall and to see a lot of new faces you all here today. I would like to join in welcoming every one of you to the 63rd session of Bhutan Dialogues. Honorable Dean, faculty members, dear students of Ugyen Tshomo School of Law, ladies and gentlemen. It is a pleasure for me to be welcoming every one of you, including those who are viewing through the live broadcast to this 63rd Bhutan Dialogue session. We, Save the Children Bhutan, and the skipper team in Bhutan are collaborating with the Ministry of Health and key population organizations in implementing the sustainability of HIV services for key populations in Asia program in Bhutan. We refer to this program as SKIPA in short. As the title suggests, the SKIPA program aims to promote sustainable HIV services for key populations such as sex workers, men who have sex with men, transgender people, people who use drugs in the region at scale to stop HIV transmission and AIDS-related deaths. One area under this program that we focus on is addressing human rights and gender-related barriers to accessing HIV and related services for key populations. We are therefore extremely delighted to work in partnership with the Bhutan Dialogues Forum and the Ugyen School of Law in organizing today's panel discussion themed Understanding and Safeguarding the Legal Rights of Key Populations. Today's discussion holds significant importance, particularly because it examines legal and social issues that disproportionately affects our key population friends who are marginalized or disadvantaged and vulnerable to many health-related conditions, including HIV. It is about fostering a deeper understanding of the challenges facing key populations such as absence of supportive legal environment, the rampant societal stigma and discrimination that these community members face, and the structural barriers to accessing care, to name a few. These issues, combined with socioeconomic and biological factors, elevate the rates of depopulation members in acquiring HIV and related health outcomes. Establishing a supportive legal environment for key populations, therefore, is imperative in the context of HIV prevention and control. Having supportive legal frameworks and interventions and efforts to address stigma and discrimination can enhance access and utilization of HIV prevention, testing and related services, which in turn can not only enable key population friends to lead healthy lives, but also can contribute towards the prevention and control of HIV. Moreover, a supportive legal environment can cultivate trust between key populations and various institutions, be it law enforcement agencies or healthcare providers. Together, we can strive to create a society where every individual's rights are safeguarded regardless of their background or identity. Doing so upholds the fundamental principles of equality, non-discrimination, and dignity for every individual, thus nurturing a society that is fair and inclusive. Our discussion today will feature esteemed speakers who will dive deeper into these crucial topics. I would like to take this opportunity to express our gratitude to Bhutan Dialogues, students, faculty, and management of Genesee School of Law, and the National AIDS Control Program of the Ministry of Health for their support in organizing this event. Thank you everyone for being with us, and let's engage in this dialogue with open minds, empathy, and shared commitment to justice and equality. President.
Now, before I hand over the dialogue to the host, I'd like to take this opportunity to introduce today's host. Sonam Tshering is a legal professional and educator, currently an assistant professor at GSW Law, where he imparts knowledge in contracts, public procurement, privacy, and media law. Additionally, he serves as an assistant dean of GSW Law's Research Center, contributes as an editor for law journals, and actively participates in various committees of the law school, including the Climate Change Task Force. Joining GSW in 2017, Sonam brings a wealth of experience from his distinguished civil service career. Beginning as an assistant legal officer in the Bhutan Narcotics Agency, he later served as a legal advisor to both the Narcotics Control Board and the Tobacco Control Board, concurrently acting as the media spokesperson for the agency. His exceptional contributions were acknowledged with the Regional Directors Award during the 2012 World No Tobacco Day from the Southeast Asia Regional Organization and WHO. Transitioning into parliamentary service, Sonam held roles such as Parliamentary Committee Secretary and Legislative Officer in the National Assembly Secretariat. His diverse background includes stints as a radio reporter with PBS, earning him the first Media Fellowship Award in 2009 from the Center for Science and Environment, based in New Delhi. Sonam advocates for social justice, evidenced by his weekly legal column in Tenzin newspaper, where he has spent over 200 articles over the last 4 years on various social issues and justice matters. Additionally, Sonam serves as Chief Counsel for Truth Justice Legal Consultancy. His academic qualifications include an LLM from George Washington University, USA, LLB from Bharati Vidyapith University, India, and a postgraduate diploma from the RIU, and a Bachelor of Science from Sharedsi College of Education. Please join me in welcoming Professor to the stage with a round of applause.
Yes, thank you, Karma. Just say it. Okay. So, hello, कोई मोला? Hello. 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 Thank you, Karma, and good afternoon, everybody. As we begin this dialogue, I would like to first introduce. Hello. Plus, Simpson, so I would like to first introduce the panels for today. May I invite Dr. Pandup Tshering as the first panelist. So, to introduce Dr. Pandup, Dr. Pandup Tshering is a highly experienced medical professional and public health leader in the country. He obtained his MBBS, Masters in Public Health, and postgraduate diploma in dermatology. Currently, Dr. Tshering serves as a professor at the Faculty of Undergraduate Medicine at the Kesakebu University of Medical Sciences of Bhutan. And his impressive career includes roles such as Health Secretary of the Ministry of Health, Director General of Medical Services, Director of Public Health Department, Registrar of the Bhutan Medical and Health Council, and Medical Superintendent of the hospital, and Registrar of the Bhutan Medical and Health Council. And his extensive expertise in health governance, planning, public health, primary healthcare management, service delivery, and emergency preparedness and response. Dr. Tshering also has held prominent international and national positions, serving on committees and boards related to civil registration, health education, disease control, women and child welfare, and among others. May I now welcome Dr. Pandup and thank you for joining us. And now I would like to introduce the second speaker, Ugyen Tshomo. Ugyen is a Chief Program Officer at the National Commission for Women and Children, NCWC, Ministry of Education Skills Development. She holds a master's degree in management from the University of Canberra, Australia, and bachelor's of degree in education from Samse College of Education. She also has a diverse background, having worked as a principal in schools, Zongkak Education Officer, and Deputy Chief Program Officer before joining NCWC in 2017. In her current role, she leads the gender agenda in Bhutan, including gender and inclusion, mainstreaming in workplace practices. She implements and supports projects related to gender and inclusion issues, advocates for policy changes, coordinates awareness campaigns, builds capacity among stakeholders. She has contributed to various research studies, publications and special achievements, including Bhutan's response to CEDAW Committee and Assessment on Violence Against Women and Girls, Gender and Climate Change, and Impact of COVID-19 on Women and Children. Welcome to the dialogue. Now I would like to introduce the final panelist, Mr. Tenzin Gyeltshen. Mr. Tenzin is the Executive Director and founder of the Pride Bhutan, an organization dedicated to celebrating diversity. Since its inception in 2015, he has been actively involved with Pride Bhutan, initially as a member and later taking on leadership roles. Appointed as the Executive Director in 2019, his primary responsibilities include guiding the organization towards achieving its mission, vision, and purpose through a strategic planning and implementation. As an Executive Director, he engages with national and regional stakeholders and partners, establishing Pride Bhutan as a key player in the national response to HIV interventions. The organization aspires to become a nodal agency promoting well-being among the SOJEC, sexual orientation, gender identity, gender expression, and sex characteristics, and the key affected population communities in the country by creating an inclusive and enlightened society where these groups can achieve their full potential. Welcome to the dialogue. So before I start the actual dialogue, just to provoke the conversation, I will state few things. I think in the Constitution, the promise as a Bhutanese that we have given under preamble is that it says, we the people of Bhutan solemnly pledging ourselves to strengthen the sovereignty of the country, to secure the blessings of liberty, to ensure justice and tranquility, and to enhance unity, happiness, and well-being of the people at all time, which means that the responsibility of each of us as a Bhutanese, not just as a state, to ensure justice and enhance unity and happiness among all of the people in the country. And the fundamental right, it says that all persons are equal before the law and are entitled to equal and effective protection of the law. We shall not be discriminated on against the grounds of sex, race, language, religion, and politics. Basically, it mandates equal access to quality healthcare without prejudice, inclusive and supporting educational environments, fair employment opportunities, and robust legal safeguards. Upholding these principles across all spheres of life is crucial for fostering an inclusive society where individuals can thrive. And Article 8, the fundamental duty of all Bhutanese, says that Bhutanese citizens shall foster tolerance, mutual respect, and spirit of brotherhood among other people of the country, transcending linguistic, regional, and sectional diversities. This is an important principle that holds profound significance in protecting the rights and dignity of individuals belonging to key population. And finally, the state is mandated to uphold the constitutional requirements to create a conducive environment in fostering gross national happiness. This includes inclusive society, and to make sure that we respect everybody's right and tolerate them. With this, I would like to begin today's dialogue, and I would like to open this dialogue by asking questions, and probably I'll just go with Dr. Pandup first. So, you already know that ensuring equitable access to healthcare services for a marginalized and unserved populations often are referred to as key population, and significant challenge is faced by these people worldwide. So what kind of measures can healthcare system implement to address disparities and probably promote inclusive access to quality care for this vulnerable group?
Thank you for the question. Now, when you say, especially for the key population, when you say that there is disparity in health services, access to quality health services, here I think we have to take into consideration two aspects. One thing is, okay, when these key populations go to the health facilities, the services that require is not available. That's one. Other aspect is that, okay, services are available in the health facilities, but that they are not able to access the services because of various barriers, maybe legal barriers, social barriers, or other even financial barriers and physical barriers. So taking that into consideration, now when you look at the health system, I think the experts they say that the ideal health system should be able to provide a health services that's comprehensive, integrated, people-centered, and also inclusive. So that is the ideal health services that should be provided, and that if you have a very ideal health system. Now, if you look at the health system in Bhutan as well as globally over last, let's say, decades or centuries, I think every health system is supposed to adapt or adopt to the changing needs of the population, changing health needs of the population. So even in Bhutan, our health system, initially, let's say, we are more focused on taking care of the communicable diseases. But now we have health system is focused more towards non-communicable diseases, mental health and all that. But now if you want our health system to be receptive to the needs of the key populations, what needs to be taken into consideration? Firstly, I think we need to have evidences. There should be enough evidences to say that, okay, the key populations has, these are the populations. And once we have this enough evidences, the next step should be, I think we should have lots of advocacy programs now. Advocacy at each level, at a higher level, at the planning and the policy making level, so that this health needs of these key populations can be incorporated into our policies, strategies, guidelines, or whatever national documents are. Once you have that in place, then probably next step should be, I think, our health workers. I think probably many times what we find is that our existing health workers are not aware of the health needs of the key populations. So our health workers has to be trained. They should be, now if they are already working in service, probably we can provide them with short-term trainings on the health needs of these key populations. And also in the long term, I think even it can be included in our teaching curriculum for health workers. What are the health needs of the key populations? So once we have this in place, the other thing is we also see that there are other barriers. Health services are there in the facilities, but maybe our key population is not able to make use of these facilities. So these are basically, I think, barriers. Sometimes stigma, discrimination that happens in the health facilities, the evidence is coming along. So in such cases also, I think it's important that we try to have more advocacies. Also, there's more interactions between the health service providers and the key populations and key population organizations. I think that will give a better opportunity to understand each other challenges and strengths of each other. Then now, for example, in Bhutan, I think policy, if you look at the health policy, I think there's already a clause that, it should be able to provide services to the vulnerable and hard-to-reach populations as well. But here, I think KPs are not mentioned. So probably it would be good to include these KPs as a hard-to-reach and vulnerable population in terms of health service. And also once you have these policies in place, the services are in place, probably it's also important that we keep on monitoring how the services are provided, whether our KPs are able to assess the services in a timely, in a quality, and in a very friendly environment. And other thing is also, it is also good, like for example, if the KPs are not able to assess the services because of other reasons, then in such cases, there is also recommendations. Some countries are also trying the digital platform where telemedicine can be used, so that they don't need to come with health facilities. They interact through this digital platform. And also, some countries are also now days where they are using the KPs, key populations because they are providing services to their own community. But in such cases, and some kind of incentives has to be paid to the KPs. It's already happening in Bhutan also, and I think the term they use is social contracting mechanism, where you use the KPs to provide services to your own community, but through some kind of incentivizing, some kind of payment for this KPs. So this way, so that the KPs can reach the population, because they know their own community is also able to access, happy to access services from their own community. So I think these are a few of the mechanisms where we can improve the services for these KPs to make it more friendly as well as accessible, and it is in line with their needs and requirements. Yes, thank you.
Yes, Doctor, thank you. So in this context, probably I will go through in terms of how you access health services in Yoga. And one of the things that we can look at is, for example, sex workers in the country. Literally, is under the penal code, it is criminalized. So which means no individual can actually publicly identify themselves, as opposed to other key population, because there is a repercussion of getting arrested. In fact, by law, if you know that they are sex workers, the penal code also imposes a duty on every individual to report that there is a criminal offense. So you can actually report saying that that person is a sex worker. So in that light, as a senior health policy expert, what would you probably, if you could maybe elaborate on a perspective on decriminalizing sex worker in the country? I know it's a very complex and sensitive issue, It's sometimes important to discuss these more complicated and sensitive issues, whether the possibility of accessing health services is going to be very difficult if they claim that I am a sex worker. So they will have to hide their own identity and then seek these health services.
Plus, I think there are lots of evidences globally, because if you criminalize this commercial sex law, so criminalizing, I think there's enough evidences to show in other countries that when sex work is criminalized, then the sex workers usually go into hiding, and they are not in a, they don't come out to take receive healthcare services from the formal health centers. So that way, especially now if you consider in terms of HIV, so they are not in a position to take HIV preventive measures. So then they become infected with HIV. I think same with other diseases also. And also there are studies where they have done like, okay, before when the sex work was criminalized, and after it was not decriminalized. They have also done, studies are there where they after decriminalizing the sex work, they found that the sex workers are coming out, they are able to access health services, both in terms of preventive and curative health services, and are able to take care of their own health, as well as health of their client. So that also means it also protects the health of the client. So that way I think it is, there will definitely be advantage, if the sex work is decriminalized, and especially from the assessing to quality health services perspective.
Yes, Doctor, thank you. So probably I will now go to Madam Ugyen, and basically I think NCWC has been a forefront in terms of writing fights, fighting for the rights of the women and children, and decriminalization of homosexuality in the country is seen as one of the most progressive measures in the region, not just in Bhutan, but beyond, when all of our neighbors are much more conservative in that context. And it is a very progressive, initiative to integrate LGBTQ+ rights into the policy. So my question would be, given this context, what are the key components that an inclusive gender policy should encompass, and how do these components would differ from traditionally that is primarily focused on men and women? Now we are talking about other genders, LGBTQ+.
Yes. Good afternoon to everyone. Let me first of all take the opportunity to thank the organizers for inviting us. We take this opportunity as a very good opportunity for us to really disseminate on a few of the things that National Commission for Women and Children do. A very complex kind of nature of our work doesn't get into the people's mind so well, and is not well received. But nonetheless, we are very fortunate that there are not only young people sitting here listening to us, what we are doing, and what we need to take forward. So therefore, this I take this as a very, very good opportunity for us to really advocate on what a few of the things that we are trying to do in order to really narrow the gender gaps and also reach to the population who are very vulnerable and are not well taken care of. With this, I would just like to really answer to the question just being posed to me. Yes, the National Gender Equality Policy, which took a very long time to get itself approved. It took really 3 years to get the National Gender Equality Policy get approved, because of the fact that it's by nature very complex, very hard to understand, and there are a lot of beliefs that there are no gender issues. Therefore, it took us a long time, and it got the National Gender Equality Policy got approved in 2020. And this policy actually is an effective framework that captures legal components, acts, policies, programs, and practices that ensures that equality and equality reaches to every population of this country. However, we realized that after the amendment of the Penal Code in 2021, we realized that there has been some issues of not really the national gender equality policy being very comprehensive in terms of not being very inclusive of the LGBT component, LGBT perspectives in the gender equality policy. Therefore, having understood that, we revised the national gender equality policy and finalized from our side in 2022 and submitted to the cabinet. That's where it stands as of now. And as response to the question, what things got into those national gender equality policy? The earlier policy had just 3 domains: political and public domain, social domain, and economic domain. And we realized that there were things that were not captured well, overtly captured well on the LGBT component. So we revised that and included a lot of components that was actually required. Like, for example, the first one is prohibition of the discrimination against vulnerable population, and really be very inclusive in terms of really considering them as also one of the key populations and their needs are met. We also looked at the areas where the protection of their rights are enhanced through the policy provisions that which I would be later on talking about, and being very inclusive in education, where the curriculum has to be changed, the sensitization and the needs of the key population, like the vulnerable population, the LGBT, the disabled are met. This is being there. And access to health, as Dr. Pandup just mentioned, there are a lot of issues in terms of enabling the health services by our LGBT community, and it's not it's really relevant really to have the rights for our LGBT community to access their needs. For example, the needs of their health needs for them is so different from the normal men and women. So this kind of accessibility are not made available, not in a sense that people don't want to provide the services, but because we are not sure of it now, we are not being sensitive about it. So that's where we are at, and also the legal rights. We have also captured legal rights where our LGBT community have all the rights, accessibility to all the rights, and also the accessibility to justice, and also their rights are actually included in the National Gender Equality Policy. Then the next one is advocacy and sensitization. We consider this as very important because of the fact that our people have to understand that there are people who are different from the normal binary, and that their needs are different, and that they are treated as like any others, but in a manner that how they would like to be treated, so that they are not discriminated, that they are considered to be also the normal people like us, but in a little different way. Another area which is a little different from the normal, the conventional kind of policy is as participation. The LGBT community have the rights to access to health and education, I just mentioned, and also in the participation in terms of decision-making level, in terms of leadership position, in terms of participating in the election, and all this. These are also some of the areas which are different from the normal kind of conventional policies that we would have actually developed. These are some areas that we have taken into consideration. Thank you.
Yes, and at the same time, as we will be floating this open forum for everybody, So if you have questions, please you can write it down and get it ready. Once we have completed one round, we would open it to the public, including those online. If you have any questions, please type in the chat box, and we have people here who will deliver these questions here. So just for information, if you need any. Maybe before I will go to Mr. Tenzin on that note, the understanding of concept of SOJEC or sexual orientation, gender identity and gender expression and sex characteristics is a very new concept and term that is emerging in the country, not just in the country but I think globally is into a, so not many people are familiar with that, and I think Madam Ugyen was talking about accommodating, creating awareness, and this forum is one of the forums that can provide you a platform where you could help us to understand what is this subject or what it encompasses and why it is important that we as a human being should understand in terms of that. So if you could.
Thank you very much for the questions. So talking about SOJEC, SOJEC stands for sexual orientation, gender identity, gender expression, and sexual characteristics. Basically, SOJI is a very comprehensive term. It usually means, or SOJEC is what makes you a human being. Let's say as a person, if I break it down, SOJEC first is sexual orientation. Now, sexual orientation is now talking about my romantic and sexual attraction. Then I talk about gender identity. That is my innermost identity of my own gender. And then gender expression is how I express myself to the world. And then we have sex characteristics is biological attributes of my body, physical body. As a whole, when you see individual person does have their own SOJEC, that is what makes us different. For me, for an example, for me, my sexual orientation is I'm a gay person. I'm a gay person, which means I'm attracted to another man. And my gender identity is that I'm a cisgender man person. That means I'm comfortable with being called as a man. And my gender expression would be I express myself as a very masculine, sometimes feminine also. When 2-3 anime sips this but then I don't drink it anymore and I don't encourage it also. So sex characteristics is I'm biologically man with the wala. So now the understanding of SOJEC, compared to LGBT is quite broad, and it allows us to embrace this diversity as a human being. When we were talking about this LGBT rights, awareness on LGBT, we were just talking about certain populations, such as lesbian, gay, bisexual, transgender. Now when we are using terms or acronyms such as SOJECs, now we are also bringing in inclusion of from the straight populations perspectives. It's how we try to educate to ourselves. That's why the terminology such as SOJEC become quite inclusive. And when you have these inclusive terminologies, inclusive identities, it makes our work much more easier, because comparing to what we were doing before 2015 towards 2018, we are talking about LGBT, this, LGBT, that, That was something, we had few people who were saying, do you feel that you are not goodness, that you defined as lesbian, gay or bisexual first and goodness later, do you feel that you are different from straight or heterosexual populations? But when we started, our idea was mainstreaming the whole LGBT movement, to the general population, the society in Alu, we have to live in this society. Ani Beodalu, then SOGAC came out, and then we became much more open to this idea of having allies from different heterosexual counterparts. This will be now, when we come to recognizing this SOGAC, not just SOGAC, but also key populations such as people living with HIV, people who use drugs, and female sex workers or sex workers in general. Now, understanding this population is because, first of all, the first step of solving a problem is that you acknowledge that there is a problem. So, when you acknowledge that this population exists, that's how you move towards being, when it comes to promoting inclusivity in terms of not just in service, but also policies level, national policies level, laws, this formulate inclusivity, and addressing the rights, because these population are first of all quite hidden, marginalized, highly impacted. These people usually are left up to you. That is why CSOs and civil society organizations, community-based organizations such as Pride Bhutan, CPA, Haksam, this reason because they have access to this population. Government agency these people will not be able to come forward because you are going there as survey. Whenever we have this interaction with we always with health workers, we always tell them, when you go to the field, you are not seen as peers, but you will be seen as someone from the government agencies. That is why people are not comfortable with you. Reason. That is why CSOs and CBO network exist and addressing their rights through these community-based organizations, and equitable access to health services. Like I said, there are lots of challenges. Despite the health services, education services being free of cost in Bhutan, why are these people not going to seek services when in fact they have this high risk behavior, having multiple sexual partners, drug and alcohol induced sexual intercourse, having sex without condom, and this way they don't go to seek HIV testing services. Why? Because they are not comfortable to go to Anila. If you plan this health intervention, that's why SKIPA exists. So if you plan the government intervention, it goes general level, general, because we are seen as equal citizen of this country. But that usually does not work when it comes to key populations, because whether you give them or not, even if it is free, they will not go to the services. And there is a very important need to address when it comes to advocacy and education to the general population. Because still there are lots of misconceptions. I think that's why we really wanted people to understand what SOGAC really means. Yes, thank you.
Yes, thank you very much. So basically, this term is not just as a new term that is applied to LGBT. It's actually it encompasses the entire population of how you express as a gender, as different identities you mean. One, I think, aspect that we can look at in all countries, including Bhutan, is that there is a cultural, religious, and societal norms that is expected out of us. As soon as my son is born, then I have an expectation. Okay, he is going to be a man, and if he doesn't become, then it is a challenge for a family, who is not, accustomed to this kind of population. So, in terms of we feel that there is a need to basically discuss and then implement the policies that is related to this kind of challenges in terms of so it's mainly to do with probably stigma, probably to do with myths also in terms of gender dance. So what are some of the very common myths or stigma that is associated with such areas, and then that would impact eventually in terms of accessing health care, accessing education and other societal, and also being accommodative in the public accommodation.
Lastly, so when it comes to myths, especially associated with Soji's community, or let's say the LGBT community, so first myth is that people usually feel that gender is binary, remember? But if you look at the definition of gender itself, gender is a social construct which can be changed and which is very, very flexible, remember, over time changement. So that's why the binary of gender usually changes, remember. That's why we have now different genders. We are now talking about men, women, transgender women, gender fluid person, agender people, transgender people. There are lots of first myth that we really have to understand. Second one is people feel that the Soji SC is something that we have brought from Western countries and European countries and brought it here in Bhutan, and then we started these movements. But then Soji SC, like I said, is your self-identity, as individual identity. It is something that has already been there, but was not put into words, word into certain terminologies and not put in. That's why I say it's not something new for us. And the third one is that people feel, when I say I'm a gay person, people feel that when I came out in around 2018, I came out in the social media, even in the BBS, saying that I was a gay person. I usually was not forced to do that, but I felt the need to do that because there were lots of misinformation. So I experimented on myself. To share you an instance, when I finished my interview in the BBS, that was BBS Nozokchi, I came out from my interview with Jordan. We were walking, and then suddenly I got a call from one of my friends who was saying, "Why you were doing? You should be straight. You are very very masculine person." So it's something that has been with me for a very long time. I have not shared with you, say, Lavchibala, because through my high schools, through my college, I've gone this. I've been living with this sense whereby I felt quite different, So it's not a choice, it is something that was with me for a very long time. When I was born, when I went through puberty, it was there. When I entered my adult life, it was there. And it is still there. It's not something that I choose over that I wanted to become. It came to me quite naturally, and the fifth or the fourth one is people usually feel that it usually threatens our cultural norms, but then I really don't feel like that because being a Bhutanese is my first identity, identity as a Bhutanese, which I'm really proud of. And whatever comes, let's say, whether I'm a transgender, whether I'm gay, bisexual, intersex, whatever, usually comes after being a Bhutanese. Then maybe after that, I would be a Shashok, a Bhutanese gay Shashok. And then, let's say, a brother, a sister, this would moving on to the sex workers, he meets this. I'm talking about just these two. So first of all, people usually feel that sex work is usually among the women. If you think that, that is very wrong. You are very wrong, because we have people who are into sex work from male population also. But then male ki the acceptance is not there. Denial na deme bola. Denial. There are male sex workers, but they are in denial. First of all, this is because ngachi male ki beudul pride chi do te ngachi pride chi. That ngachi sex work beza baby zado say we don't any, we are ashamed to accept that bola chi. And the second myth is that people usually feel that ani la be go mano rozumbe ikthang jo kauche be la be mangoni digi sex work be mesi bola. And people usually ask why do you do sex work? I think that is a wrong question. The question that you should be asking is like, how did you end up in this situation? That would be the right question, because we deal with sex workers community on a daily basis. There are people who have been the victim of child abuse. We will wait for that to end. So continuing my point, so usually when we work, we have this interaction with female sex workers, let's say in a daily basis. So the interactions, when we started first, this is mobilizing these communities in a way. Lots of the people, the majority of people, I'm not saying all of the female sex workers that we have dealt with, came from Manila, economically challenged background. So why people go to sex work? Or why do they enter sex work? Is first of all, usually are the victim of child abuses, because they have been abused by their uncles, their neighbors from a very early age. Second of all is dysfunctional families. They come from quite dysfunctional families, whereby either the parents are divorced, and the one is financial, family financial status also plays, economic status also plays a very big role when it comes to women who are getting into sex work. Not just women, we also have sex workers among the LGBT population also. So that is the second myth. And the third myth is when we were talking about decriminalization of sex work, when we have these conversations of decriminalizing sex work in Bhutan, the conversation usually goes towards trafficking. People are usually saying, if we decriminalize sex work, then there will be people trafficking, because we should really understand sex work and trafficking is a different issue, first of all. Although there is trafficking in sex work in Nadu, but then when we are talking of decriminalization, we are talking, especially when you have this interesting policy advocacy training, we were drafting, and then we had a few participants for sex work community in Nadu. The interesting conversation that struck was, we are not saying government to fully legalize decriminalize, whereby we are asking government to come and monitor and regulate us. So that kind of ideas and attitude that we have from the female sex workers communities. So probably that's it from my side.
Les, thank you, sir. So, very interesting conversation going on. I'll open the floor to the public so that we can have, and I have enough questions here, but I think I'll give the opportunity to the floor as well as those who are online. If you have any questions, so the floor na let's see anybody. Just raise your hand and. Plus, we have one. Professor Dema.
We know that prostitution is criminalized, and also, sir, right now pointed out the pros and also the cons of decriminalizing prostitution. But then again, it is an open secret here in Bhutan that there are sex workers very rampant in the borders, but otherwise elsewhere also there are many. So I was wondering, what is, or the state, or what the NCWC or whoever the agencies responsible are doing to safeguard the legal rights of these sex workers? Because earlier Dr. Pandup shared the advantages of decriminalizing prostitution and how the sex workers came forward, and it was easier in terms of protecting and safeguarding their legal rights. Whereas in Bhutan, we are, I guess, not able to do that because it is under the penal code at the time. So I just wanted to know what is being done to protect the legal rights of these sex workers.
Yes, maybe we'll take one more question together, if we have. Okay.
Thank you very much for this opportunity. My question also mainly revolves around the issue of sex work. So while the general consensus of the text has already been pointed out, is that the moment we have sex work, no one directly assumes of a male prostitute. It always jumps to the issue of the society or the government having this benign responsibility on protecting the piety and purity of womanhood. So in this way, even the issue of gender expression, how gender roles are taken into consideration by the nation as a whole or society, can be taken into consideration. Then again, in comparison to other nation states where the movement against the LGBTQ plus society against sex work is mainly driven by purely and highly centralized directed religious movements or highly directed cultural movements. And forgive me for my general assumption, but from a guess of what I can say, that Bhutan really doesn't have that strongly established tradition or certain verse we can directly point out and say that Bhutan as a nation state cannot accept these ideas because we have not such a tradition which has been established. So when Bhutan's case, we're dealing with an issue which is not fueled by anything particular. So how do relevant stakeholders, then again, of course, with public consultations and other programs, how do you deal with a situation or an issue which is not driven by anything concrete and which sort of seems to be nothing more than a national issue of societal interpretation of the sex work and the LGBTQ issue?
Les, thank you. In the meantime, I would like to request the organizing team to get any questions online delivered to me while we have the response from here. So, I think I'll go with Professor Dema's question first to Dr. Pandup and then followed by Ugyen, very briefly.
This, of course, I think I have also explained earlier, is now, of course, at present, I think this sex work is criminalized as per our code. But in terms of service, assessing service, health services, I think there is no provision anywhere to say that we should deny health services to this group of people. But it is to other channels, like for example, if they are criminalized, then they are scared of coming out in the open, and because they feel that they are criminalized. That's why they are not coming out to seek services now. And especially in the border towns, I think there is also some information that has been gathered that sometimes they are also using services across the border, which are now maybe not real health services, but more from unauthorized, unqualified health professionals, which further affect their health. So, and like I said earlier, if you can, there's enough evidences in other countries to show that decriminalizing the sex work has definitely improved the health service, access to health services, as well as health of the sex workers as well as their clients.
Yes, thank you. So maybe Madam Ugyen could respond to that also. Same question.
Sex workers can be women, men, LGBT, children. And we need to firstly understand why are these people falling into that category of job. I think rather than really fighting for legalizing, which might be appropriate at some point of time, but at the moment, if we ponder into what is actually putting this section of society into that kind of profession, isn't it because they are not able to access education to the required qualification? Their family background is so disadvantaged. They come from a single parent. They come from a poverty line of people. They are exposed to a lot of other related issues or the peer pressure. We feel it's important, coming from National Commission on Women and Children, we feel that these underlying issues need to be addressed first in order not to let our section of society get into such kind of job. And I think rather than always talking about fundamental rights, I think there are fundamental duties that we need to also ponder upon the same moment. So therefore, legalizing might reduce stigma and other related issues that we have, hiding and all they can, but when it comes to children, women, they might fall into more vulnerable, and inequality in terms of gender might widen, exacerbate the inequalities and vulnerability if we legalize this job. Say, this is what I personally feel is needed. Therefore, maybe in long run we might have to, but at the moment, a handful of population, I think we can take care addressing all the underlying issues. This is my submission. Thank you.
That's a very interesting response in terms of, because earlier we said that decriminalization, no legalization, regulated. So a lot of now terms are coming into play. How the state agencies understand and how those in the system are also understanding. So with this, I'll just not actually put the follow-up question, but in the interest of time, what I would do is probably I'll ask Tenzin sir to respond to the second component on LGBTs are not actually opposed through established religious organizations or other societal norms that is happening around the other countries nearby us, in India, in Bangladesh, all of this, where we don't have any kind of established opposition. And why do you still think that they have to be looked at in a different manner and protected?
That's Bhutan especially is exceptional case. It's a case that is worth studying further when it comes to LGBT movement that was driven you see that South, even Asia region in Bhutan, we are much more comfortable than other countries. Even certain Western countries, we are much more comfortable than what is being done here. When it comes to, let's say, opposed but then there is nothing also. There is usually nothing. Decriminalization we have done. Decriminalization we are done. My rights as a Bhutanese person is guaranteed by the Constitution of Bhutan. and the responsibility that I have to the state and my country is also enshrined in the Constitution of Bhutan. But after that, what? Do I get to marry the person of my choice la? And this me what la? Do I get to adopt children? Do transgender people have access to hormone replacement therapies in the countries? Do I have somewhere to go when I am being stigmatized based on me being a gay person? That I face violence, when I face violence because I'm a gay person. And then we use these general rules and regulations, remember, which is good. That's where when we feel that we are the part of society, remember, as a Bhutanese citizen this way. But when it comes to top of the mountain, like the view from here is a very generalized view. But when you work in the field, when you see challenges every day, when you see members going through mental health, depression, anxiety, just because they they belong to LGBT population, facing violence from their family members, even their parents, being homeless or being chased away from their homes just because they are gay, bisexual, or transgender people. Where do we usually go? Which sections, which penal code guarantees that my right will be protected just because I'm in LGBT population? That's why during my previous I was saying targeted interventions egomi reason chirani of the world, because when you make laws in general there will be it is sure that people will fall through the cracks. Even social systems social security systems people usually fall through agenda. Let's take the case of COVID-19 vaccination vaccination case and prevention case we were sure that generalized services generalized services we thought that everything would be fine. Access to vaccination I'm some problem with things. But then what we didn't anticipate was we had to do extra work. Why? Because accessibility to information technologies was not there among the transgender women population. Why? Because they lack education qualifications. And usually English then translate translate even then we translate to then we were updating them on vaccination routine Romi stigmatized galusuni training centers when we were implementing, and it was COVID-19 go through time, we were collecting data on HIV self-testing implementation. I was in Samjongha time. Data collection bay, I was in quarantine in Anahil. Then one of the training center called me and told me that Bushi onulo, Gogenulo. There was the ID card, Bungi Badi image. Now where do I put this person? Remember? Training chief digi. Then I was saying probably animi di gati comfortable baby na anigi facility na two male female gina. The male na yes la male na two and female. Then we were having this conversation, and suddenly he said, "Do I have to take off his clothes and see what the private parts does that person has celebrate?" Then I said, no, you don't have to do. But the best way was Bumda Chikaritsu Bishabi Biwachin Achichi Tapte Tung Selape Anibisila Anubi. Now that is how we work in Bhutan, in our personal relationship. I know someone, he knows someone, my friend knows someone. But something unfortunate happens. Do we have mechanism written in black and white that guarantees, okay, when this kind of things happen, this should happen, and these are the penalties? That's why we have been pushing forward for a very long time.
Thank you, sir. Thank you. This is very interesting. Just to share with you, recently the Royal Bhutan Police detained a foreigner who happens to be a transgender. And when detention was, had to be done, they had no idea what to do. So what they have done is they have kept that person in the dining hall. And because they never had that kind of experiences in the past, remember. And I think these things are, very complicated. Person with disabilities. We had a story where a disabled person called 113 and he had a speech issue. And the police thought that he was just joking with them and they just dropped the call. Fortunately somebody came on the road and they actually saved him, because the disabled person was, not injured that much, but the other person was fully injured. So we can see the challenges that we face. I think basically Tenzin sir is talking about equal protection under the Constitution. Constitution does provide two components. Equality before law, it applies to everybody in general, but equal protection is a very specific component, and I think that is what we are talking about. And if you have questions, we can still open to the floor. Floor na questions we have one. Online memo lang na online gi observe me this week.
My question revolves around access to healthcare. So I think it's a very well-known issue here in Bhutan that unless you know somebody personally inside the healthcare system, you usually can't avail those particular services. I mean, healthcare is free and open to everybody, but for example, you have to do a surgery for something, and then if you're able to know a particular surgeon, you can get that surgery done in a matter of weeks or even days, as opposed to people who have to actually wait for 2 to 3 months. And I was wondering what we could do as a society, as lawmakers, as doctors, as healthcare availers to tackle this issue, so that everybody gets equal opportunity and access to healthcare. And second, there's this issue where there's only one MRI scan in Bhutan, and that's in the Thimphu hospital, and that presents a lot of challenges and problems. Wherein if you want to avail those services, you have to wait 3 to 4 months. And afterwards, that private hospitals have put up proposals to the government to buy MRI scans of their own and to issue them in their own hospitals, but the government doesn't allow that. So I was wondering what's the reason behind that and what we can do to, again, provide equal healthcare services to everybody.
Yes, the question is not actually targeted towards the theme that we are discussing, but it does affect the theme because everybody has to access it. I wish Dr. Pandup is the health secretary today so that he will be able to actually respond. But in the meantime, I'll still give opportunity to Dr. Pandup and Madam Ugyen if you have anything to add. But I think I will give it to Dr. Pandup as a former secretary and who also now as the faculty of the medicine. So if you could provide particularly in context of key population accessibility has become a major issue in Lana.
Thank you. I think that question. I think I have been asked that question quite a lot of times when I was a service. And especially to access to healthcare, it is a very broad. And also, when you talk of access, there are so many factors related to it. Now, now I think we are talking about I think appointment system in JW, as well as that people I think people whom if somebody knows somebody there, I think you have easy access to the services and all that. I think this is to do with more with the management. So one solution I see is that now all our health service is getting digitalized. Now we have the electronic patient information system, which I think has been already rolled out in the AW and is being now rolled out in all the district hospitals. So I think that will give an opportunity to streamline this system now. So at least because till now I don't think we had a proper system of monitoring. Only we are getting let's say the monthly report or annual report where a number of patients are seen. But with this new digitalization, it's called electronic patient information system. With digitalized system in place, probably then each doctor will be given number of patients per day. So every that patient is monitored. Every doctor or health worker, whoever is providing services, can be monitored by the management on a regular basis. So probably I think that will improve. We are hoping that will improve the services in terms of waiting time, in terms of assessing the service providers and all that. So maybe that will be one way that these things will improve. The other thing is regarding MRI. Actually, if you talk of MRI and CT scan, they say that globally is 1 million population, 1 CT scan, 1 MRI is not available. When we initially worked on this putting in MRI and CT scan in the country, that time we were told that for 1 million population, 1 MRI or 1 CT scan is enough. But here we have now, of course MRI is only in Thimphu, but CT scan we have already put in 5 other hospitals also. So now I think you are talking about why private practice is not allowed. Now, if you see the health policy, it's not private practice, but they say private participation in health is allowed. Our health policy says that private participation in health is allowed. Even our MPI policy actually allows private participation in health. But why it is not? Probably one thing because our policy says that if you have to open a private health facility, it has to high-end, multi-specialty. That's basically what we look at is now. Suppose I, as a retired doctor, if I open a private health facility, I should not be opening a small room with my few equipment, and I check the patient, take the money, and if the patient gets serious, you go to the health JW or you go to the government hospitals. So that way, then the accountability will not be there in the doctor. But please see this, my personal view. So if somebody has to open a hospital, it has to be fully placed, all the specialties should be there. So that way I think it is very difficult for individual doctors to really propose. Because there are also some studies done that if you open a private hospital, then probably the number of number of individuals you have to put, the number of health workers you have to employ, then they say that it will be very not cost effective. Not cost effective. Unless you have a mechanism where you have patients coming from outside. So that then the cost effectiveness is there. Maybe that is also a reason why I think we have not received any, I think government has not, the ministry has not received that big proposals on establishing. Quite a lot of conditions are there for establishing this private hospitals. And on the other hand, this also private diagnostic facilities are allowed. So that is basically initially was done only for the labor screening at the point of entry, but I think now even retired officials are open. So this private practice, I don't know what is the existing present policy, but in the past, health policy allows private practice, and FDI policy allows opening private hospitals now. But like I said, I think no one is really coming up because the requirements are there. So to fulfill the requirements is quite difficult. That's my answer for now.
Last, Dr. Last. So I think we got additional information in addition to whatever we are discussing. Maybe we'll have a last round of questions. So if you have people who have questions, you can raise your hand. Meanwhile, I have one question for Madam Ugyen. Mr. Tenzin said that he does not have the right to marry of his choice. No. So my question to Madam would probably be, as a NCWC who actually looks at the women and children, should women have the right to marry another woman? Basically, your personal opinion in terms of, as I know, how do you feel about things? Well, I think men definitely, Tenzin sir will have to take it over, and then, yeah, that you're going to say.
Actually, I'm trying to look a provision that we have already put in the National Gender Equality Policy now. But before I put on this the question, earlier question, one thing on the referral mechanism, the appointment issues. For the women and children, and of course gender-based violence in Bachela, we have established something called one-stop crisis center in the hospital. And if there is a risk, and if the case manager, we have like a multi-sectoral approach to addressing the gender mechanisms. And in there, if the case manager finds out, and if the survivor agrees, if it is adult, we really emphasize on the consent as well. So there's if the case manager finds that there is a need for health related services that survivor needs, then that survivor is immediately referred to the one-stop crisis, and do not actually follow the routine that making line and getting coupon and all this stuff. We don't have to wait, people can go there. But what is actually not happening is because people are not aware that such facilities are there. So it also tells us that all of us need to be aware of it, and also be as a frontliner and understand that where are the services available. To the question, anyway, I will just read out even the. This is not approved, but from the past experience of policy making, many policy development that we have done, not major change things happens because we develop all the policies through a lot of consultation, different stakeholders. Like for example, to integrate gender LGBT plus perspective into the National Gender Equality Policy, we took almost whole of the year consulting the community themselves several times because we wanted things to come out much more than what they said in relation to health and education. And beyond that, there was not much things coming out, so we had to really pressure them because we didn't know much, but we knew there were much more than health and education related issues alone. We also did with service providers like health and education. They are the major service provider, and what kind of policies needs to be changed, so we put in a lot of all these things, Sessionila. Sorry, I can't remember. We have said that a revision of the Marriage Act itself, we have recommended in our policy that review the Marriage Act of Bhutan 1980 and other relevant acts, including legal procedures from gender and LGBT perspectives. I thought this was very comprehensive. And in terms of LGBT marriage, it's not only marriage among the same sexes, there are other marriages, there are also adoption component, there are also change of their identity issues that request, and these are all included in the draft policies.
Yes, thank you, madam. Thank you very much. I think we are able to get a lot of new information. My question to Mr. Tenzin could be, there are people who think that LGBT group has never been opposed by anybody in a society, and LGBT group or these kind of people are trying to play a victim game, and they would like to have sympathy from the state with additional resources. What is your response to, to like this kind of like?
First of all, I would say that playing a victim card, mola. We are the victim, mola. We are actually a victim, but we play the card last. We are both, mola. But then when it comes to machi LGBT population, take a transgender person to wala. Let's forget about her childhood. You step out of the house. The moment you step out of the house is a challenge. Then, while you are walking, people are looking at you. Mola, you are looking at you, talking behind you. Mola. Then you get into the taxi mola, taxi na bewachin. Mola, jachi chizol peru. Machi last na do tiru tu kamji asigar say the bewachin la. 150 yasunula sar se mewa depa transforming dilu mola. Na makeup this to gar again the sar se mewa dela. They are not thin mola bazana pata atrishe. Just imagine a person who has been constantly told you are not supposed to do that. What you are doing is wrong. The person who have been facing for violence from their parents, their peers, schools na bewachin, let's say schools na bewachin, bullying, name calling, and this baby. Just imagine that one person. Any person they do when you feel they are playing victim card, when they are sharing their stories of the struggles, the challenges that they has gone to, if you feel that is playing a victim card, then that is your problem first of all. Because first of all they are victim of abuse, and sharing stories necessarily does not mean that we want to extract funding or blackmail our states or the government giving us more money because challenges PL HIV namsami bindu sex workers ki mamdu LGBT atiti sex workers the reason why we tell stories, why we communicate our challenges is because we want to see the change in the society, not just society but service delivery points, service zovigi namdigi nalu, service design baby namdi nalu, policies formulation baby time nalu, discussions baby nalu. We want representation. We want representation. We want to make sure that our voices and cultures are heard, so that next time when you policy dato jo bill ti dato pass besha darung machi component chu darung sex workers ki component chu tele halam ji 2-3 years ne LGBT ki component chu tele halam ji disability ki component ya chu and it's going to be something that one ladichi meba deve the lokchi bewi that happens why because you do not have representation from different communities. That is what is happening in other communities. The reason why we usually communicate, why we are usually loud, me I'm not that loud, but Machiki population are usually loud, especially even meetings in our conference. People are usually loud. Why? Because they have gone through so much in and they have reached to certain points whereby they usually don't entertain such kind of nonsense in and usually are very wild, especially meeting and very loud, very straightforward sometimes. So I don't feel that when we are communicating our concerns, when we are sharing our challenges, I don't think that we are trying to play the victim card. But we are bringing the ground realities to you, so that you can connect to that population or person at a human level first of all. That's why when we say health workers, when we do advocacy, do not treat that person as a transgender woman. First of all, you treat that person and see that person as a human being and give the respect and dignity as same as others. Last, thank you.
I'll take the privilege of asking last one question, although we are on time, to Dr. Pandup on confidentiality. People say that there is zero confidentiality in the health system. Anybody can go with a CID and get anybody's medical report, and then and a lot of things are actually registered, are open in the public, and with today's technology, somebody can just take a snapshot of all of the numbers, phone numbers, details, everything. So there's a lot of, especially even in the rural areas, a lot of things are still not online. So any privacy mindu say, and then we talk about protecting the key people, medical reports, whether sex workers, LGBT. So how do you actually defend yourself and say that health, there is a huge good confidentiality only because the lawyers have not taken the part to sue the Ministry of Health for lapses in the confidentiality?
Yes, thank you for the question. Now, to begin with, I think all the medical health professionals are required to be registered with the Bhutan Medical Health Council. And Bhutan Medical Health Council has an act and also a regulation 2005. So, as per the act as well as the regulation of Bhutan Medical Health Council, if any health professionals is not following up, because one of the important regulations under the Code of Ethics, Conduct, and Etiquette, under chapter, I think confidentiality, maintaining the patient confidentiality is very important. It's one of requirement of health professionals. But yes, I think we have some information that the maintaining confidentiality of the patients are also not respected. This is happening because one thing is, I think our maybe health professionals, they forget, okay, they are member of the health council, they have signed that. Actually, when they enter into the service, we always give them awareness, advocacy, it is mandatory. We always, because I was head of the medical council for about 5 years, so it's mandatory that we get awareness, tell them about this. Only thing is, now when this confidentiality is breached, I think there is no formal reporting mechanism there. And many times when the report is given, there is no evidence to say that, okay, so I think we should remember. So now, especially for the KPs, I think it's very good. We came to know that Ministry of Health in collaboration with the Save the Children is developing one system called feedback mechanism now, where it's a formal mechanism where KPs has the right to put in complaints in case there is a stigma, discrimination, or this confidentiality issues and all that. So I think there is one mechanism I think which can improve. So once the feedback is given, then probably as per that mechanism, some action will be taken against health professionals. Probably I think that will improve the maintaining confidentiality of systems. Apart from that, I think it's also like I said earlier, I think it's more advocacy is required. And also more interaction between the key populations and the health workers. I think these are all, all has to go together now. And I think the institutes, I think we always discuss stigma and discrimination. So this actually is a professional code of conduct, health professional. Confidentiality, stigma, discrimination, these are actually against our code of conduct, ethics and etiquette.
Last doctor, thank you. In the interest of time, we would like to conclude this.
Sorry,
yeah, please. 5 seconds.
Just to add on this, what went as a provision into the National Gender Equality Policy, exactly to this consensus, because these councils were shared by our LGBT community, we put a very discreetly institute mechanisms to address discrimination and stigmatization against LGBT while enabling health services and violation of confidentiality by the health service providers. But this is in paper now. the work is to really educate, train our health service provider and also other service seekers to also report if the confidence is broken, because this is only the way that we can improve the system. Thank you.
Thank you, madam. I'm quite sure Tenzin sir must be little, happy with that. We have Dr. Pandup has one more to go. Please, very briefly.
About I think about the private practice. The policy, from the policy point of view, we need to monitor this out-of-pocket expenditure. Globally, they say that if the out-of-pocket expenditure goes above the required, that means if the people are spending more on health, then the poverty increases. That also actually at the ministry level we also monitor that to see that. But I think only if you really, our studies shows that only about, if you really do private practice, then probably about 10% of the people will be able to actually pay for the private services more. That is one. So that's why the out-of-pocket expenditure, if it increases, if you probably open private practice, probably then out-of-pocket expenditure on health for the general public will increase, and that will have impact on the poverty of the country. So that's just for clarification on this private practice. Thank you.
Thank you. Very interesting. That private practice, whether to do or not, is a big debate that still remains. As a lawyer, we get to practice privately. With this, I would like to conclude this session, and maybe just to summarize whatever we have discussed. I think one of the things the NCWC looks at is that initially the national gender equality policy did not contemplate the new things, emerging things that is coming up. So it was not inclusive enough, and now I reiterate that it is inclusive, and it will address a lot of issues that is concerning with the the key people, the key population. And Tenzin sir has said that Soji Sikh is not just about LGBT or just about key population, but it applies to every gender and how you identify yourself. And he also said that while there is no push from the society in terms of direct oppositions being LGBT, but there is a indirect way of not being able to exercise their rights, such as adoption, such as marriage, and even existing health facilities are some of the major issues. And also in terms of looking at the confidentiality, which is a very important component in terms of protecting the rights. Dr. Pandup has said that there is a code of ethics. Although there are lapses, the lapses are very minimal, which can be rectified. I think I agree to that. All institutions have flaws, bad people, good people. So it's how we correct the bad people from there. And with this, I would like to thank all our panels for having this session, and also the audience for having this session. I would like to hand it over to our MC. Thank you very much.
Chiefs of the law, distinguished speakers, ladies and gentlemen. Sampo and the organizers, the Chiefs of the Law Research Center, Bhutan Foundation, and Save the Children would like to express our sincere gratitude and appreciation to several individuals and organizations for their invaluable contributions which made this event a grand success. First and foremost, we would like to convey our deepest gratitude to our esteemed moderator and speaker, Professor Sonam Tshering, Dr. Pandup Tshering, Ms. Ugyen Tshomo, and Mr. Tenzin Gyeltshen, who graciously accepted our invitation and traveled all the way from Thimphu to be with us. Your presence, expertise, and willingness to share your valuable insights have enriched our understanding and knowledge immensely. We would also like to extend our heartfelt thanks to the Tasha team and JSW Law for hosting the program at the law school premises, and for the immense effort in making the necessary logistical arrangements that played a pivotal role in ensuring a smooth conduct of this event. Let me not forget to extend our gratitude to Save the Children for your generous funding, without which this event would not have been possible. Your support has enabled us to bring diverse perspectives and foster meaningful discussions on critical issues. We express our sincere appreciation to the JSW Law students, faculty, staff, and everyone who took time to join our program virtually, and your active participation, thought-provoking questions, and insightful contributions have made this event more fruitful and engaging. Finally, we thank everyone who was involved in the planning, execution, and attendance of this event. Your collective efforts and contributions have made this gathering a success. Once again, our heartfelt appreciation goes to all those who have played a role in making this event a remarkable experience. Your involvement and support have been invaluable, and we are truly grateful for your commitment and fostering knowledge, sharing, and intellectual discourse. Thank you very much.